Tonight, we're taking a closer look at changes to the COVID vaccine policy. They were ordered by the head of the U.S. Department of Health and Human Services with support implementing them from other top medical officials. Our Christine Fresno sat down with one of those top officials, the new head of the Food and Drug Administration, Dr. Marty Makary, to talk about what's behind some of those changes.
From the highest levels of government, the changes have been sweeping. FDA Commissioner Dr. Marty Makary says the days of a one-size-fits-all regulatory approach are over.
The most dangerous thing you can do in public health is to put a recommendation out with such absolutism when the data really doesn't support it.
His agency, the Food and Drug Administration, recently joined the director of the National Institutes of Health and the new Secretary of Health and Human Services to advocate for big changes to COVID vaccine policy. The FDA wants to see more rigorous trials and evidence before future vaccines are approved, raising concerns about side effects like myocarditis that followed early COVID vaccine use in some, and complaints from some who believed getting the shot would protect them from getting the virus at all. The CDC recently removing healthy pregnant women and healthy children aged 6 months to 17 years from its recommended list.
The COVID emergency is over, and people are appropriately asking, if I'm healthy and young, do I need that COVID booster? And we are telling the companies that we're not going to blindly stamp a COVID vaccine for young, healthy children every year. We'd like to see some updated clinical trial information.
When the vaccine is no longer recommended, that means it's no longer covered in a lot of cases. What do you say to those people who say, like, you know, I want to get this, I feel like it's helping me?
Well, the coverage decisions are up to each individual insurance carrier.
Those insurance carriers, though, no longer required to cover the shot for those groups. The American Academy of Pediatrics joined several other organizations now suing over the changes.
The chief concern for the professional medical associations is that pregnant women and children won't have access to this safe and effective tool for preventing serious effects of COVID.
KFF's Josh Michaud says that could mean more illness and possibly more death, just as epidemiologists report a summer surge in COVID cases in several states. I'm Christine Fresno reporting.